Hello, this is Chris Courtney, the Community Coordinator for Siouxland Cares. In this presentation, I'll be providing an analysis of substance use trends in Siouxland over the past couple decades. Substance use trends shape the health and safety of our community. Over the past few decades, Siouxland has seen significant changes, some positive, some concerning. But what do the numbers really tell us? And how can we use this information to build a healthier future? In this video, we'll explore key substance use trends in Siouxland using data from sources like the Siouxland Cares Sioux City Metro Area Youth Survey, SAMHSA's National Survey on Drug Use and Health, and varying public health reports. We'll highlight areas where we've made progress and discuss new challenges that require our attention. By understanding these patterns, we can better support prevention efforts and keep our community safe. To ensure a comprehensive understanding of substance use trends in Siouxland, we gathered data from a variety of sources, both local and national. A key resource is the Tri-State Drug Task Force, a multi-agency group made up of federal, state, and local law enforcement agencies. These agencies work together to monitor drug activity and enforcement efforts across the region. At the local level, the Siouxland Cares Sioux City Metro Area Youth Survey provides valuable insight into youth substance use trends over time. This helps us understand how prevention strategies are working and where improvements are needed. Nationally, we relied on multiple organizations such as the CDC, the Substance Abuse and Mental Health Services Administration, and the National Institute on Drug Abuse, which track drug use, health statistics, and addiction research. Additionally, the FDA, the American Lung Association, and the American Cancer Society contribute data on health impacts of varying substances. Beyond the US, we incorporated international data from the European Union Drugs Agency to identify trends globally. We also examined economic projections from Grandview Research to better understand the financial aspects of substance use, such as the growth of newly introduced substances. By combining these sources, we can provide a clear and well-rounded picture of how substance use is affecting our region, both from a public health and law enforcement perspective. According to data from the Tri-State Drug Task Force, drug seizures in the Siouxland Tri-State area have fluctuated significantly over the past couple decades, reflecting shifts in matters such as drug trafficking, availability, and enforcement efforts. Methamphetamine seizures saw substantial variation with significant increases throughout the 2000s and 2010s, rising from 3,900 grams in 2007 to 15,600 grams in 2008, before dropping to 3,600 grams in 2010. However, seizures then climbed again, reaching 12,000 grams in 2012. The largest jump by total grams occurred in 2017 to 67,000 grams. After fluctuating in the following years, methamphetamine seizures hit a high of 129,000 grams in 2021 before decreasing to 66,000 grams in 2022 and 31,000 grams in 2023. Cocaine and crack seizures were relatively low for much of the early 2010s, dropping from 3,900 grams in 2007 to just 90 grams in 2009. After minor fluctuations, seizures spiked to 18,000 grams in 2017, dropped again in 2018, and remained low until another increase to 6,000 grams in 2022, before decreasing again to 631 grams in 2023. Marijuana and cannabis product seizures saw similar fluctuations, with 81,000 grams seized in 2007, peaking to 209,000 grams in 2008 before steadily declining to 12,000 grams in 2011. Seizures rebounded in 2017 to 118,000 grams, peaking again at 173,000 grams in 2022 before plummeting to 7,000 grams in 2023. Heroin seizures primarily decreased with a peak of 9,000 grams in 2018 before dropping sharply to 2,000 grams in 2019, 251 grams in 2022, and disappearing entirely in 2023. Meanwhile, fentanyl's recent rise saw seizures go from 2,000 grams in 2018 to 3,000 grams in 2023. Substance use in Siouxland includes both legal and illegal substances, each with its own set of regulations and health impacts. We'll start by looking at legal substances, such as tobacco, alcohol, and marijuana, examining their use and evolving trends in our community. Note that despite looking at overall marijuana use, marijuana will be categorized as legal due to its medical stature and evolving analogs that can be legally purchased. Across all regions analyzed, past month alcohol use among individuals aged 12 or older remained relatively stable, consistently ranging between 50 and 60%, according to data from the Substance Abuse and Mental Health Services Administration, or SAMHSA. National rates were consistently lower than the Midwest region in all states encompassing Siouxland. Nationally, past month alcohol use ranged from 50% to 52.4%, peaking at 52.4% in 2013-2014. In the Midwest, rates fluctuated between 52.9% in 2002-03 and a peak of 55.2% in 2012-13. South Dakota had the highest rate of alcohol for 10 years straight, beginning in 2002-03. After a decline from 2012 through 2014, it briefly regained the highest rate in 2014-15 and again in 2016-17. From 2017-18 to 2018-19, South Dakota experienced the greatest decrease in alcohol use, dropping from 58.1% to 54.4%, falling below Nebraska and Iowa by the end of the tracking period. Starting at 55.3% in 2002-03, the highest in the region, Iowa decreased to 52.7% in 2006-07 before increasing steadily, reaching a high of 58.4% in 2016-17. By 2018-19, Iowa had reclaimed the highest rate in the region at 57.8%, surpassing both Nebraska and South Dakota rates. Nebraska followed a similar pattern as Iowa, reaching 55.6% in 2004-05 before declining to 51.9% in 2009-10. It then rebounded to 58.9% in 2015-16 before decreasing to 55.4% in 2018-19. Despite SAMHSA data revealing generally stable rates of alcohol use among 12 and older, trends among youth in the Siouxland Cares Sioux City metro area use survey show a steady decline in alcohol use over time. In 2002, 50% of 10th graders and 58% of 12th graders reported alcohol use in the past month. By 2012, the percentages had dropped significantly, with a 50% decrease to 25% of 10th graders and a one-third decrease to 39% of 12th graders. This downward trend continued with only 13% of 10th graders and 22% of 12th graders reporting alcohol use in 2018. In 2019, the survey began tracking 11th graders, in which it found that 14% of 11th graders reported alcohol use. By 2022 and 2024, the percentage had dropped to just 8% for 11th graders. According to SAMHSA, between 2015-16 and 2018-19, binge drinking rates remained relatively stable nationwide, hovering around 24.5%. However, the Midwest consistently reported higher rates, ranging from 26.4% to 26.6% during this period. In Iowa, binge drinking peaked at 29.7% in 2016-17 before declining slightly to 27.9% in 2018-19. South Dakota had the highest rates in the region, reaching 30.8% in 2016-17 before dropping to 26.4% in 2018-19. Nebraska's rates remained relatively steady, fluctuating between 28.8% and 29.2% during these years. Local data from the University of Wisconsin's County Health Rankings further illustrates these trends. In 2014, excessive drinking rates were 20% in Woodbury County, Iowa, matching the state average and exceeding the national rate of 15%. 19% in Dakota County, Nebraska, slightly below Nebraska's 20% average, and 18% in Union County, South Dakota, just under the state's 19% average. By 2024, excessive drinking rates had changed, with Woodbury County increasing to 21%, while Iowa's state average rose to 23%. Dakota County decreased to 18% compared to Nebraska's increase to 22%, and Union County increased to 19%, aligning with South Dakota's statewide rise to 22%. While binge drinking remains higher than the national average in the Midwest and states encompassing Siouxland, there is a positive trend among Siouxland's youth. According to the Sioux City Metro Area Youth Survey, binge drinking among local high schoolers has steadily declined over the years. In 2002, 44% of Siouxland 12th graders and 37% of 10th graders reported partaking in binge drinking in the last 30 days. In 2012, 10 years later, the rates stood at 27% and 15% respectively, nearly 40% decrease among 12th graders and a nearly 70% decrease among 10th graders. By 2018, these rates had fallen again to 12% among 12th graders and to 5% for 10th graders, indicating another nearly 70% decrease for binge drinking among 10th graders. Despite ceasing data collection for 10th and 12th graders, reduction in binge drinking among 11th graders was continued to be identified from 7% in 2019 to just 3% in 2024. According to SAMHSA, tobacco use across the United States and the Midwest region has followed a relatively similar downward trend over the years. From 2002 to 2019, the national rate of tobacco product use in the past month decreased from 30.1% to 21.3%. The Midwest region, which had consistently higher rates than the national average, also saw a decline from 32.8% in 2002-03 to 23.9% in 2018-19. Iowa mirrored this national and regional trend, with tobacco product use among individuals dropping from 30.9% in 2002-03 to 25.2% by 2018-19. Nebraska experienced a similar decrease, starting at 30.6% in 2002-03 and falling to 22.98% by 2018-19. South Dakota, which had began with the highest rate of tobacco use in 2002-03 at 35.1%, experienced more significant fluctuations throughout the years. The state initially fell below the Midwest average in 2006-07, but regained the highest rate in the region in 2008-09. South Dakota remained the highest in the region before another decline in 2013-14, falling back under the Midwest average. However, it quickly reclaimed the highest rate again in 2014-15 and continued to maintain this position through 2017-18. South Dakota's rate then fell below Iowa's in 2018-19, ending at 24.1%. Much like SAMHSA data, tobacco use trends from the Siouxland Cares Sioux City Metro Area Use Survey show a significant decline over the years, with substantial decreases in the percentage of youth using tobacco products. In 2002, 34% of 12th graders and 27% of 10th graders reported tobacco use in the last 30 days. By 2012, the percentage of tobacco use among 12th graders dropped to 21%, and for 10th graders, it fell to 12%. This represented a 38% decrease among 12th graders and a 56% decrease among 10th graders. In just the 2 years following, tobacco use continued to decline, with 12th graders reporting only 14% use and 9% for 10th graders, a further decrease of 33% and 25% respectively. The trend continued through 2018 with 12th grade tobacco use dropping to 8% and 10th grade use falling to 4%. Data collection for 10th and 12th graders stopped in 2018, but collection continued for 11th graders. In 2019, the survey showed that only 3% of 11th graders reported tobacco use. A decline occurred in 2022, showing only 1% of 11th graders reported tobacco use. However, in 2024, there was a slight increase back to 3%. Unlike tobacco use, the SAMHSA data on marijuana use in the past month shows a clear upward trend across the United States from 2002 to 2018-19. In 2002-03, the national rate of marijuana use among individuals aged 12 or older was 6.18%. By 2018-19, this figure had increased to 10.8%, reflecting a growth of approximately 75%. The Midwest region followed a nearly identical trajectory, starting at 6.14% in 2002-03. Marijuana use in the Midwest rose to 10.28% by 2018-19, marking an increase of about 67%. Iowa, Nebraska, and South Dakota followed different trajectories, despite all three seeing increasing rates like that of the Midwest and nationally from 2002 to 2019. In 2002-03, Iowa marijuana use in the last month stood at 4.9%. The state then saw decline usage over the next 5 years, sitting at 3.3% in 2007-08. Usage then increased for the next 4 years, reaching a new high of 6.1% in 2011-12. Despite another decrease over the next couple of years, the rate of marijuana use in the last month ended at 6.7% in 2018-19, an increase of about 37% from 02-03. In Nebraska, the rate of usage stood at 6% in 2002-03. The trend was relatively similar to that of the Midwest and national rates, with the exception of minor decreases from 2010 to 2012, where thereafter it continued to slowly increase, ending at 8.4% in 2018-19, an increase of 41% from 2002. South Dakota saw marijuana use start at 5.24% in 2002-03 and increase to 6.35% by 2018-19. This represents an increase of about 21%, the smallest increase to take place among the states encompassing Siouxland. Despite increasing rates of marijuana use among those 12 years and older across the country and in the Midwest, data from the Siouxland Cares Survey shows a steady decline in marijuana use among high school students over the years. In 2002, 25% of 12th graders and 24% of 10th graders reported marijuana use. By 2012, these numbers had decreased to 17% and 13%. In 2014, marijuana use among 12th graders dropped further to 12%. However, 10th graders reported a stable rate of 13%, suggesting marijuana use was actually more popular among these individuals than their 12th grade counterparts. By 2018, the rates were 15% for 12th graders, an increase from the prior survey, and 11% for 10th graders, indicating a return to lower consumption rates than their counterparts. Data collection for 11th graders then began, revealing a 10% usage rate in 2019. This downward trend continued in subsequent years, with marijuana use among 11th graders decreasing to 6% in 2022 and further dropping to 4% in 2024. While legal substances like tobacco, alcohol, and marijuana are widely used and regulated, illegal substances such as cocaine, methamphetamine, and heroin continue to pose significant challenges in Siouxland. Let's take a closer look at the trends and impact of these illicit drugs. It should be noted that while methamphetamine is legally available by prescription, called Desoxyn, meant to treat ADHD and obesity, most methamphetamine used in the United States is produced and distributed illicitly other than through the pharmaceutical industry. According to SAMHSA, methamphetamine use in the United States increased between 2015 and 2019, with notable region variations in the Midwest and Siouxland region. Nationally, past year methamphetamine use among individuals aged 12 or older rose from 0.58% in 2015 to 0.7% in 2019. The Midwest followed a similar trend, increasing from 0.45% to 0.72%. Iowa experienced the most significant rise in methamphetamine use during this time. In 2015 to 16, past year use was reported at 0.57%, but by 2018-19 it had nearly doubled to 1.1%. The largest increase occurred between 2017-18 and 2018-19, when the rate jumped from 0.86% to 1.11%. Nebraska saw a more stable pattern, with rates fluctuating between 0.51% and 0.67% before slightly declining to 0.6% in 2018-19. South Dakota was the only state in the region to see a decrease in methamphetamine use from 2015 to 2019. It had the highest rate of past use in 2015-16 at 0.95%, but usage declined over the next 2 years, reaching 0.64% in 2017-18 and 0.66% in 2018-19. Youth methamphetamine use in Siouxland has also shown fluctuations over time. As indicated by the Siouxland Care Survey, in 2002, methamphetamine use among 10th graders was reported at 5%, while 12th graders reported 4%. By 2012, these numbers had declined to 2 and 3%. However, in 2014, usage among 12th graders spiked to 6%, while 10th graders remained at 2%. By 2018, reported use dropped again, with 1% of 10th graders and 3% of 12th graders indicating past 30-day methamphetamine use. From 2002 to 2019, cocaine use in the United States and surrounding states encompassing Siouxland displayed periods of fluctuation, with some notable declines in the 2000s, followed by relatively stable rates in the early 2010s and slight increases in later years. Data from SAMHSA shows that in 2002-03, approximately 2.5% of individuals aged 12 or older in the US reported using cocaine in the past year. This figure gradually decreased through 2009-10, reaching 1.8%. From 2011 to 2019, there was a slight rise, peaking at 2.1% in 2017-18. In the Midwest, the trend mirrored the national patterns, but at slightly lower rates. The rate of cocaine use in the Midwest started at 2.5% in 2002-03 and decreased steadily through 2009-10, dropping to 1.5%. There was a slight increase after 2010, reaching 1.8% in 2016-17 and peaking at 1.9% in 2017-18, then falling to 1.8% in 2018-19. In Iowa, the rate of cocaine use started at 2.2% in 2002-03 and showed a gradual decline over the years. By 2009-10, it had dropped to 1%. The rate saw a slight uptick, reaching 1.4% in 2012-13 and remained relatively steady, sitting at 1.4% in 2018-19. Nebraska started at 2.1% in 2002-03, increased to 2.3% in 2005-06, then began falling to 1.4% by 2009-10. After a slight increase to 1.7% in 2016-17 and 1.8% in 2017-18, it returned to 1.7% in 2018-19. South Dakota's pattern showed a more stable decline, starting at 1.9% in 2002-03. The rate decreased to 1% in 2010-11, with minor fluctuations through 2019. By 2018-19, the rate stood at 1.1%, the lowest rate among all states in the Siouxland region. Looking at the Siouxland Cares Sioux City Metro Area Youth Survey, we can see more specific data for Siouxland youth. In 2002, 6% of 12th graders and 5% of 10th graders reported using cocaine in the last 30 days. By 2012, the rate had dropped by nearly half to 3% for both 12th and 10th graders. In 2014, cocaine use in the last 30 days increased to 6% for 12th graders, but decreased to 2% for 10th graders. In 2018, 3% of 12th graders and 1% of 10th graders reported recent cocaine use, showing a slight but continued decline in youth usage. Like cocaine, heroin use in the United States has fluctuated over time, with more significant regional variations occurring in the states encompassing Siouxland. According to SAMHSA, between 2013-14 and 2018-19, heroin use in the past year among individuals aged 12 or older in the U.S. ranged from 0.28% to 0.34%. The Midwest consistently reported similar rates, peaking at 0.35% in 2016-17 before declining slightly to 0.31% in 2018-19. In Iowa, over this same period, past year heroin use increased nearly 50%, rising from 0.17% in 2013-14 to 0.25% in 2018-19, with a slight decrease occurring in 2014-15. In Nebraska, rates remained relatively steady, fluctuating between 0.21% and its peak of 0.29%, which occurred in 2013-14, the first year data tracking began. In South Dakota, heroin use spiked to 0.36% in 2015-16 from 0.18% in 2013-14, a 100% increase over the 2-year span, reaching the highest in the region before declining by nearly a third back to 0.24% in 2018-19. Unfortunately, heroin use was not tracked by the Siouxland Cares Metro Area Youth Survey. However, according to the National Center on Drug Abuse Statistics, annual heroin use among 8th, 10th, and 12th graders has consistently declined from 0.8% in 2010 to 0.2% in 2020. Looking at the current state of heroin use, according to SAMHSA's 2023 National Survey on Drug Use and Health, 0.2% of Americans aged 12 or older, or 660,000 people, reported using heroin in the past year. The highest percentage was among adults aged 26 or older at 0.3%, or 629,000 people. Young adults aged 18 to 25 reported 0.1% usage, or 27,000 people, while adolescents aged 12 to 17 had the lowest prevalence with less than 0.1%, or 4,000 people. Additionally, 0.2% of Americans aged 12 or older, or 587,000 people, were diagnosed with a heroin use disorder in 2023. Adults aged 26 or older had the highest rate at 0.3%, while young adults aged 18 to 25 were less affected with less than 0.1% diagnosed. Beyond these well-known illegal substances, we are seeing a rise in emerging risk and new threats, including synthetic opioids, vaping products, nitrous oxide, and other high-risk alternatives. These substances are rapidly evolving and require continuous monitoring and intervention. Cigarette smoking has been steadily declining over the past 50 years, but new concerns have emerged. According to the American Lung Association, in 1965, over 42% of adults in the US were smokers, compared to less than 14% in 2018. Youth smoking rates have also fallen dramatically from a high of 36% in 1997 to just 9% in 2017. However, the rise of electronic cigarettes and vaping products appears to be making up for it. Between 2011 and 2019, the percentage of high school students who used e-cigarettes skyrocketed from 1.5% to 27.5%, and among middle schoolers from 0.6% to 10.5%. Based on the FDA's 2024 National Youth Tobacco Survey, 19% of US middle and high school students, representing 5.28 million youth, reported ever using any tobacco product, while 8.1%, or 2.25 million students, reported currently using one. Among them, e-cigarettes were the most commonly used tobacco product, with 5.9% of students, or approximately 1.63 million, currently vaping. Broken down further, 7.8% of high school students and 3.5% of middle school students reported current e-cigarette use. Many youth e-cigarette users are not just experimenting, but using them frequently. More than 1 in 4 reported daily use, while 38.4% reported using them at least 20 of the last 30 days. Flavored e-cigarettes play a significant role in youth vaping, with more than 8 out of 10 current users preferring flavored varieties. The most popular flavors include fruit, followed by candy, desserts, and other sweets, as well as mint and menthol. Notably, over half, or 54.6% of students currently using e-cigarettes reported using flavors with ice or iced in the name. The type of device used also matters. Among current e-cigarette users, the most commonly used device was disposables, making up 55.6% of usage, followed by pre-filled or refillable pods and cartridges at 15.6%. As for brands, the most commonly reported among youth users were Elf Bar, Breeze, Mr. Fogg, Views, and Juul. The e-cigarette and vape industry continues to grow rapidly. According to Grandview Research, the global e-cigarette and vape market was valued at $6 billion USD in 2020 and surged to 28.17 billion by 2023. The market is expected to expand further at a compound annual growth rate of 30.6% from 2023 to 2030. Industry associations have formed to counter anti-vaping regulations and to regulate business practices, fueling further expansion. While traditional smoking may be on the decline, vaping is filling the void, and its rapid rise among youth remains a major public health concern. Nicotine pouches, which first entered the US market in 2016, according to the CDC, have rapidly gained popularity. According to the FDA's 2024 National Youth Tobacco Survey, nicotine pouches were the second most commonly reported tobacco product in use, with 1.8% of individuals reporting current use. Of these students, more than 22% report using them daily, and nearly 30% report using them at least 20 of the last 30 days. Additionally, the survey reveals that over 85% of youth users preferred flavored nicotine pouches, with mint being the most popular flavor, followed by fruit. Referencing the top graph, a study led by researchers at the American Cancer Society, shows overall sales of nicotine pouches increased during 2019 to 2022. Study authors analyzed data comprising weekly Nielsen IQ retailer scan point of purchase sales from August 2019 through March 2022 for 2,182 local trade areas in the contiguous 48 states and Washington, D.C. Sales trends of four nicotine pouch brands, Zyn, Rogue, On, and Velo, were analyzed. Zyn at 58.8% led the overall unit share, followed by On at 24.6%, Velo at 12%, and then Rogue at 4.8%. The results showed overall sales increase from 126 million units in August 2019 to 808 million units in March of 2022. Furthermore, the study found that products with the highest concentration levels were also increasing, with sales of products with 8 milligram nicotine concentration level increasing more rapidly than products with lower concentration levels of 2, 4, and 6 milligrams. According to Grandview Research, the global nicotine pouch market size was estimated at 3.95 billion USD in 2024 and is expected to grow at a compound annual growth rate of 34.4% from 2025 to 2030, outbeating vaping devices. The growing interest in nicotine pouches among younger consumers who are trying to quit smoking, coupled with the rising demand for alternative products that do not involve lung exposure, will likely be the main beneficiaries of industry growth during the forecasted period. The rise of nitrous oxide misuse, aka laughing gas, has become a significant concern, especially in recent years, as larger tanks of flavored nitrous oxide have become more accessible, being marketed and sold as whipped cream flavoring, giving them the legal access that most illicit drugs fail to possess. This has made it easier and more attractive for users to consume higher doses, leading to an increase in inhalant misuse and its associated dangers. Reports from the European Union Drugs Agency show a sharp rise in nitrous oxide related poisoning cases across Europe. For instance, in Denmark, cases rose from 16 in 2015 to 90 in 2020, and in the Netherlands, reports climbed from 13 in 2015 to 144 in 2020. In France, 134 cases were reported in 2020, up from 46 in 2019 and 10 in 2017. This increased access to nitrous oxide, which is often inhaled for its euphoric effects, has directly contributed to the growing concern over inhalant use. In the United States, data from SAMHSA shows that inhalant use remains a significant issue across all age groups, however, somewhat surprisingly, more so for adolescents. Between 2015 and 2020, past year inhalant use among individuals aged 12 or older ranged from 0.6% to 0.9%, whereas adolescents aged 12 to 17 consistently exhibited the highest usage rate among any age groups, ranging from 2.2% to 3%. Young adults age 18 to 25 reported inhalant use between 1.4% and 1.7%, while adults age 26 or older experienced lower rates, gradually increasing from 0.3% in 2015 to 0.5% in 2020. More recent data reveals that from 2021 to 2023, 0.8% to 0.9% of people aged 12 or older, or approximately 2.2 to 2.6 million individuals, used inhalants in the past year. Among these age groups, again, adolescents aged 12 to 17 showed the highest rate of use at 2.2% to 2.4%. The rate for young adults age 18 to 25 ranged from 1.5% in 2020 to 2% in 2023, the highest percentage seen among this group to date. And for adults age 26 or older, it ranged from 0.5% to 0.6%, again rising in 2023. The growing misuse of nitrous oxide, particularly in the form of flavored canisters sold as whipped cream ingredients, has led to an alarming rise in inhalant use, especially among adolescents. This trend, coupled with the increasing availability of nitrous oxide and the concerning data from both Europe and the US, highlights the urgent need for targeted intervention and education to address inhalant misuse, with a special focus on adolescents who remain the most affected. Synthetic opioids have played a major role in substance use in the US in recent years. Overdose deaths in the US have risen dramatically since 1999, with a sharp acceleration beginning around 2013. In 2022, overdose fatalities exceeded 107,000, doubling from 52,000 in 2015. This surge directly coincides with the growing prevalence of synthetic opioids, particularly fentanyl, which have become the primary driver of overdose deaths since 2016. South Dakota, Nebraska, and Iowa have long had some of the lowest overdose death rates in the US, but those rates have risen significantly since 1999. In 1999, South Dakota's rate was 0 per 100,000, Nebraska's was 2.3 per 100,000, and Iowa's was 1.9 per 100,000. By 2005, the rates had increased to 5.5 per 100,000 in South Dakota, 5 in Nebraska, and 4.8 in Iowa. In 2018, they had climbed further to 6.9 deaths per 100,000 in South Dakota, 7.4 in Nebraska, and 9.6 in Iowa. By 2022, the rates had increased more than fivefold from 1999, reaching 11.3 deaths per 100,000 in South Dakota, 11.8 in Nebraska, and 15.3 in Iowa, reflecting a steady upward trend. Despite Despite this significant swing upwards, the three states encompassing Siouxland remain the lowest among overdose deaths. However, it is not a guarantee that such status will remain. Of course, as we can see by the two maps reflecting overdose deaths in 1999 and 2022, this is not only a regional concern, but a nationwide epidemic that will continue to get worse without effective prevention and awareness efforts. Now that we've discussed the challenges that Siouxland and the US faces with substance use, let's talk about what we can do as a community to address these issues. The first step is education. We need to talk with youth, families, and community members about the risk of all of substances, including vaping, nicotine pouches, nitrous oxide, and synthetic opioids. Providing evidence-based information in schools, workplaces, and at community events helps ensure people understand the dangers and make informed choices. Furthermore, prevention and intervention are key. By advocating for stronger policies and enforcement, we can help limit youth access to harmful substances. Early intervention programs can help make a huge difference for those at risk. Additionally, promoting life-saving tools like Narcan or naloxone and fentanyl strips can help prevent overdoses and save lives. Addressing substance use requires a team effort. Partnering with local government agencies, prevention coalitions, and organizations strengthens our response. It is also important to connect individuals with treatment and harm reduction services and to share available resources and helplines so those in need know where to turn. Finally, real change happens when we take action together. Encouraging open conversations about substance use and mental health helps break the stigma. Staying informed on emerging drug trends allows us to respond proactively, and supporting policies that prioritize public health and safety will lead to a stronger, healthier Siouxland and country. By working together, we can reduce substance use risk and build a safer community for everyone. Thank you for taking the time to listen.